All right, I guess we do have a quorum after all. So welcome to the September 16th Human Services Committee meeting. We can do a roll call in for quorum.
Councilmember Harry Harris.
Here.
Councilmember Ravel.
Here.
Councilmember Reed. Councilmember Burns.
Here.
Councilmember Harris.
I'm here, but I can't count for quorum. I'm on vacation.
And so we do have a quorum in person and one and Councilmember Harris joining us virtually. Can I get a motion to approve our minutes from the August 19th Human Services Committee meeting?
I move approval of M1, approval of minutes of the regular Human Services Committee meeting.
Second.
All right, it's been moved by Councilmember Hadakatis and seconded by Councilmember Ravel. Any changes? All right, let's do a roll call because we have one online.
Councilmember Harry Harris.
Aye.
Councilmember Ravel.
Aye.
Councilmember Burns.
Aye.
Councilmember Harris.
So can I get clarity? Again, I'm on vacation, so I don't think I'm eligible to vote.
Oh, it's not business related?
No, I'm
Okay.
not even going to tell that story. No.
Yeah, well, you can.
I don't think I can vote. I think I can
Yeah,
comment,
you can't
but I
vote,
don't think I can
but
vote.
you're happy to join us, of course, on the meeting. So we're happy to
Yes.
have you here. Okay, so minutes are approved. Next up, we have public comment. Do we have any public commenters here in person? Is this the list here? Okay. First up, we have. Is this Ann Pantoga? Sorry, it was the G that was messing me up. Pantoga. No, it's all good.
Good evening.
Thanks for
committee
joining us.
members. My name is Ann Pantoga. I'm the attorney for Dr. Palologos. I'm here on the beekeeper issue that's back before the committee. I went and reviewed the meeting video from November 2023, and from that meeting, there was Council Member Harris stated that there should be a compromise that's equitable to both sides. That one bee sting was one sting too many. Take this off. Committeeman Burns said that it made a recommendation, or said that it would be recommended to move the hives, and that to review the ordinance and the process for objections on beekeeper licenses. We left the last meeting in November, believing that Ms. Nisi was going to move her hives to the other corner of her yard as recommended by this committee. We are not privy to the communications between the city, the retained bee expert, and Ms. Nisi, but we're here because apparently she has refused to compromise and move the hives to the other side of her yard. Dr. Palologos has been a resident of Evanston since 1990. The bees are still populating in her pool. Fortunately, no one has been stung this summer. But as we understand it, the committee, I think last month, in August, addressed a complaint relating to another beekeeper where a neighbor of that beekeeper was also stung on the eyelid. So this is not an isolated instance where bees are stinging neighbors. We're asking that the committee take immediate and enforceable action for Ms. Nisi to move her bee hives to the other side of her yard, and then strongly consider revoking her license if that's not done. We understand that if that was a recommendation at that time. We ask that actually be an order at this point. So thank you.
Thank you. Nina Palologos.
Hi, everybody. I will say that I've taken a number of steps to sort of mitigate, the bees being attracted to my pool. It hasn't really worked very well. I've not planted flowers this year. I used to plant, I'm not against pollinators. I actually used to plant like coneflowers and things like that would attract pollinators. So I haven't done that. I've got very few like some hostas will bloom, and there's but I've basically filled my yard with non-flowering plants. I planted multiple pots of mint around the perimeter because I read that kind of repelled them a bit. Every time I have people over, I light like coils, citronella coils for partly the smoke. And still, and I get that there could be other flying insects that are stinging insects, but I've lived there a really long time. I know how many bees are in my yard, and there's still a ton of them, and they're attracted to the pool. And I have tons of pictures. It's hard. It's not like I've got a phone in the pool with me, and I don't want to mess up my iPhone. And they move, they flit around in there, so it's hard to kind of get a good picture of them. But there are still multiple bees that are attracted to the pool. I personally would prefer that the hives are not next door, but we all came to what the recommendations were back in November with strong recommendation from an entomologist beekeeper and this committee for her to move the bees to the opposite corner, away, which I'm not sure if that would have helped or not. But personally, I feel like it undermines actually the authority of this committee to not have people follow those sorts of recommendations. And, obviously my bias would be that it's too populated of an area for us to have hives so close to people. But, I'm kind of a rule follower, so I'll follow whatever rules are made by this committee. But I will say that while no one has been stung, there certainly are people that get very frightened when they land on them or land on the floats or land in the water or land on a kickboard. And it's really stressful to have so many of them flying all around us. And I would just ask for your consideration and, enforcing the recommendations at a minimum. So that's all.
Thank you for your comment. Mary Nisi. Oh, I'm sorry. Jessica Hopper, sorry.
Good evening, Council. My name is Jessica Hopper. I'm an Evanston resident and also Miss Nisi's regular house sitter, and someone who spent a ton of time in her yard. You don't need to take my picture, sir. You can sit down. I know, but you did. I don't want that. I don't need to be in the Evanston Round Table. Thank you. I routinely, when I'm house sitting for Miss Nisi, set up a lawn chair in her yard that might be 8 feet from hives that have, what is it? Like 60,000, 100,000 bees, something like that. Sebastian says over 100,000 bees. I regularly have spent long hours in Miss Nisi's yard. And over the last couple summers, as her house sitter and as her friend, as someone who also allows my children to play in the yard, and recently had a birthday party with 40-some people. You know how many bee issues I've had? None. But what I do remember, and what hasn't been mentioned, is that all of the stinging issues that were happening next door have gone away since Mary's neighbor, I forget your name, found and had the gigantic wasp super hive that was in her own backyard mitigated. And that Mary has done everything else, as far as I know, that this committee and now the, 3 different experts that are from the state, the beekeeping expert brought in by the city, I believe at your expense, all said this is totally fine. Maybe once the wasps went away, that was the issue. But I spent a lot of time in her backyard and I've never been stung. I sit next to the bee superhighway and it's hugely inspiring. to see all the bees at work. That's all I have to offer. Thanks.
Thank you for your comment. Mary Nisi.
Hi. Do you have questions for me or?
We may when we get to that section in the agenda, but for now, no questions. Would you like to make any public comment ahead of those discussions?
I guess. I mean, I want to clarify one thing is that the recommendations from the entomologist were in the body of an email, just saying if you want to throw a bone, then you maybe could move them. It wasn't in the actual official record. And I spoke with Brittany, and I understand that she actually sent you a follow-up email clarifying her state that her stance that I did not need to move them. And so, you know, I'm not entirely sure why we're here again. But it also is, I mean, there was a giant wasp nest that once it was abated by Nina herself or whatever, there was poison that was in the hole, all the stinging stopped. So I'm sorry that she has to exist in the world with insects when she goes out to her pool. That I'm sorry that the world has to somehow impact her and she can't handle it. But it's part of the deal is when you go outside, there might be insects. There might be things they're going to step on. You might step on things. They might land on your pool floaty or inside your margarita. She has lots and lots and lots and lots and lots and lots of parties. Almost every night of the summertime, she's having a party. And I don't besmirch that. Have a party. You have a pool. Invite people over. But for people who are so afraid, there's still a lot of people back there. So, you know, I don't understand why her property wasn't inspected when all of this was going down, and had that been happening, they would have found the giant wasp nest that was on her property, and I wouldn't have been brought into this. But as a result, I've had 7 different times people coming over to inspect my property. And every time all those experts said, I see nothing wrong. It's borderlines on, I mean, not from the inspectors, but it is maddening that at no point has Nina taken any kind of responsibility for her own property issues and pointing her finger at me while deflecting the real problem. And I do believe that had the department inspected her house, we wouldn't be here right now. And it's frustrating because I get reached out to, I mean, I've now had 3 articles written about this in the Evanston Roundtable. I've got beekeepers contacting me all over the area all the time about this. This is a thing that every beekeeper is looking at because they don't know if the things that are going to happen in this room is going to affect them. And it shouldn't have, because other than me not knowing that I needed to get a license, I got the license immediately because I had everything right, because I've been doing this correctly. I got my license. That's the only thing I've done wrong in this. I have complied. I have made time. I'm missing sales calls right now for my business because I'm here. I do my sales calls on Mondays. I'm missing that because I'm here. I'm losing money by being here. So I appreciate all the work that you guys have done. And I'm sorry that this has come in front of you so many times, but I need this to be over with. I desperately need this to be over with. And I want to feel welcome in my yard. I want to feel like I want this to be over with. So I did not move my hives, in case you guys are wondering. I didn't, because in beekeeping, there's a rule. You move your beehives 2 feet or 2 miles. If you move them less than that, the bees will not, if I move my hive 5 feet, the bees will come back to where they were and they will die right there because their home disappeared. That is a thing in beekeeping. So moving my hives across the yard wouldn't have done anything. It would have been just a thing so that Nina could notch a win in a fight that she picked with me. And the only reason why she knew about my bees in the first place is because they swarmed. And when they swarmed, that's how I found I needed the license. So there was good that came out of that. I was able to be in compliance. I am also a rule follower. So unless you guys have any questions, that's what I got for you.
Thank you. Yeah, we'll call you back up if we have any other questions or any questions. Thank you. Would anyone else like to provide a public comment either in person or online? Okay, seeing none, we will move on to items for consideration.
I'll move
Real quick, seeing if there's no objection, Director Ogwell has asked if we can move HS2 first.
I'll move item HS2, communicable diseases and sexually transmitted infections overview.
Second.
All right, it's been properly moved by Councilmember Reed, seconded by Councilmember Hedekadis. And do we have a presentation?
Good everyone. We have our we have our communicable disease control unit in front of us who'll be providing a presentation regarding communicable diseases in Evanston and how we work hard to prevent them.
Good evening, council members. My name is Elizabeth Lassiter, Senior Communicable Disease Surveillance Specialist here for the city's Health and Human Services Department. I'm here tonight with my team to talk to you a little bit about the important work we do within our unit. All right, great. The main goal of our unit is to protect the Evanston community from infectious diseases. Am I quiet? I need to go a little closer. Okay, so sorry. So again, I'm Elizabeth Lassiter with the city's Communicable Disease Unit here. Our primary goal is to protect the Evanston community from infectious diseases, and we do this by preventing illness and controlling the spread of disease. We conduct disease surveillance and do a lot of education with individuals as well as the community at large. The city of Evanston is unique in the fact that we have our own certified health department. So this means we have the same rules, requirements, and authorities as a county health department, but we're directing all those resources just within the city of Evanston. This certification means that our team has to follow up on approximately 100 different reportable conditions anytime those come to us. And this is required for us to keep our certification. And I did bring Director Ogbo here has a poster that lists out those 100 conditions or so. So I'd just like to ask you to take a quick look at what those are. Some of them maybe you've never heard of. Some of them are thankfully very rare, while others you'll certainly know and are fairly common. And I have a few here on the slide that just want to highlight some of the things that are on that list. So some of them include foodborne illnesses like salmonella, vaccine preventable diseases like chickenpox, mosquito-borne illnesses like West Nile virus, bloodborne pathogens like hepatitis B and hepatitis C. Our team's also responsible for responding to emerging pathogens, novel pathogens. Of course, a great example is COVID-19 that we all just lived through, but I've also put on here a multi-drug resistant fungus called Candida auris. This is an emerging pathogen in our healthcare settings. In 2023, our team received 960 reports of disease that can be found on that list. So this is a CDC flowchart that talks about how these reports come to us. So typically a person feels sick, they go to the doctor does some tests, and one of those comes back positive for one of the reportable conditions on that list. Then either the doctor, the hospital, the laboratory reports that to us at the health department. This could be done via phone, secure email, fax, although typically it's the laboratory sending us an electronic report with that positive test. It comes to the state of Illinois, their statewide system, and then they filter out and send us the diseases that we should be looking into. This is a requirement by law that providers and laboratories have to report those conditions to the health department. Then I just added in this one little box in here because it's a really important part of our work, this case investigation. So from the 960 reports that we received, we have to investigate each one of those and determine whether or not it meets a standard objective set of criteria that CDC or the Illinois Department of Public Health sets. And that's called the case definition. And so case definitions are really important to our work. It standardizes everything. It means that every report is evaluated, counted, and looked at in the same set of eyes so that a case here in Evanston is counted in the same way as in Springfield or the same way in the state of California, and all the data is comparable across geography and time. So then once we're sure that this report meets the case definition, that's kind of where we're taking this action. And that's the final blue bar that's on there. And the reason why these things are reported to us so that we can take action. So typically we're always educating the patient when we talk to them. That's one action step we take. We might also have to reach out to their school, workplace, daycare. We may communicate with their contacts to let them know about exposures or recommend preventative care or testing. It may involve a restaurant inspection or a visit to a nursing home. It really varies depending on the disease and the results of the investigation. But all the actions we're taking really help us prevent the spread of disease and control what's been going on in the community. And very briefly, this is not work that we can do alone. So here I've listed a number of the partners that we have in the community. These are people we work with on a daily basis that help us achieve this common goal of preventing illness. And lastly, I'd like to take just a minute to introduce my team. And so first I'd like to ask Sarah Franks to stand up. So she's a nurse who joined us in the spring of 2020 for the COVID response. Her focus is on long-term care facilities, infection control and prevention in healthcare settings, and multi-drug resistant organism investigations. Sarah's also leading us. Tomorrow we're going to be going on site to one of our congregate care settings to help them respond to an outbreak. So 7 a.m. we'll be on site there with the Illinois Department of Public Health, helping them with their response. Then we have Sue Whiting. She's also a nurse we pulled out of retirement to help us with the COVID-19 response. She's been with us since the fall of 2020. And she also works with congregate settings and investigates hepatitis B and hepatitis C reports. And we also have MJ Grayboys, disease intervention specialist. She joined us in March of 2023 to focus on STIs and HIV, as well as sexual health and wellness. And I'd like to turn the presentation over to her now to talk more about her work. Thank you so much.
Good evening, committee members. My name is MJ Grayboys. I'm a disease intervention specialist here at the City of Evanston's CD unit, and I'm excited to share with you a bit about our unit's work with STIs and HIV. I'll start with some background on STIs and HIV in our community. So of the average of 800 confirmed and suspect cases that the CD unit responds to in a given year, reportable STIs account for over 60%. On this slide are the numbers of newly diagnosed reportable STI cases in Evanston residents across the last 3 years. The asterisk indicates that 2023 is still provisional and is subject to change. As you can see, in recent years, numbers of newly diagnosed STI and HIV cases in Evanston residents remain steady. HIV case counts smaller than 10 are withheld to protect our community members' confidentiality. Of note, the numbers on these tables reflect only cases diagnosed in Evanston residents, whereas the CD unit follows up on all STI and HIV cases diagnosed or treated in Evanston, regardless of residency. And this is mandated by the Illinois Administrative Code and reflects the treatability of STIs. Most case follow-up takes place only with the healthcare provider to ensure adequate treatment. To illustrate this difference, in 2023, we observed 23 cases of syphilis in Evanston residents, whereas the CD unit followed up on 99 cases of syphilis. Now, with this background, what do we at the CD unit do? Like Elizabeth said, our goals are to prevent and to respond to illness to support the best health of our community. So before an STI or HIV is diagnosed, we're in the community, we're speaking with residents, connecting community members with safer sex supplies. We've got an online ordering form on our website where folks can get free safer sex supplies. We also have sexual health and wellness events where we talk to folks about safer sex and provide these supplies free of charge. We also connect residents to local healthcare providers for routine services like vaccination, STI screening and treatment, and prep for HIV prevention. We also work closely with local healthcare providers to make sure that they have up-to-date information about screening recommendations, emerging concerns, and best practices. Then When a new STI or HIV infection is reported, we respond following up with the testing provider to ensure that the person has been informed of their results and accesses adequate treatment. Prompt and adequate treatment stops the train of transmission in our communities. In some cases, we also reach out to residents and their contacts to offer them completely confidential counseling, health education, and referrals. And this follow-up builds relationships, builds access, and builds skills that meet community members' needs beyond the infection itself, connecting them with healthcare providers and healthcare resources that will support their health and well-being in the long term. In addition to this, the CD unit provides what's called surveillance-based services, or SBS work, where we work with residents of the city of Evanston who are living with HIV who may need additional support to access or stay in HIV care. Why do we do this work? Well, HIV care and HIV medication allow folks to live long and healthy lives, so we want to support the life and the health of our residents. But importantly, also, HIV medications stop the HIV virus from multiplying in the body. And when taken as prescribed, they can bring the amount of HIV virus in the blood so low that it cannot be detected. People who are undetectable for at least 6 months cannot transmit HIV through sex. And this concept is called undetectable equals untransmittable, or U equals U. U equals U means that supporting the health of our City of Evanston residents and supporting their access to HIV medical care is really benefiting their health, but also our entire community. This strategy of treatment as prevention is a very efficient way to target limited HIV prevention resources. But unfortunately, the same social factors that contribute to inequitable risk of HIV infection also act as barriers to seeking and staying in HIV medical care. So the CD unit, through this surveillance-based services, works with folks who are living with HIV to address these barriers to care. We provide confidential support, education, and connections to a huge variety of resources, whether it be just for a healthcare provider that is culturally competent and respectful, or to insurance, medical case management, supportive housing, help paying for medications, and so much more. So far this year, we've connected with 43 community members to support their access to HIV medical care. Not everyone needs help. Some folks may have just lost track of time, but they have a healthcare provider that they like and that they can afford, that they would like to continue seeing. But others are in need of more support. And of these folks, we've reconnected 9 folks to HIV medical care, connected 11 folks with medical case management. This medical case management includes things like benefits navigation, so like making sure that you have a way to pay for your medications and your insurance. We've also supported folks in taking daily medication and reducing their risk of ongoing HIV transmission. Thank you so much for your time.
Thank you. Any questions?
Yeah, I have one question for you. I'm curious, what is the cost of, we know, for example, with the Biden administration has worked to bring down the cost of insulin to $35 a month. What is the cost of HIV medication per month?
I'm really appreciative of this question, and I just want to make the plug that no one should go without HIV medication due to inability to pay. It is something that is covered by all insurance, and if folks don't have insurance, there are ways to get it covered for free. The monthly cost, I'm not sure off the top of my head, but I'd love to look into it. Generally, folks shouldn't be paying much at all.
Okay, thank you.
Yeah, thanks to you.
Any other questions? Councilmember Ravel.
Well, I just appreciate that we're having this report. I think I was not aware that we had this wonderful program, and the number of cases that you're helping is pretty dramatic. I mean, I would have had no idea. Is it a comparable level of cases based on our population compared to other communities in Illinois?
Hi, thank you so much for the question. I'm not quite sure the answer on how to compare that. I think it would depend a little bit on the disease, that there's some variability based on geography and things like that. Like, for instance, we see more Lyme disease cases here in northern Illinois than in southern Illinois. So there could be some variability like that. And I'll let MJ answer too as it relates to the STIs.
Thanks.
And as it relates to STIs, the most common symptom of an STI is no symptom at all. So STI rates are really reflections of access to regular medical care. And because we have such high access to regular medical care here in Evanston, so many fabulous providers that are offering frequent STI screening, I'd say we catch cases that would otherwise go untreated, but comparable to our peers.
Yeah, great. Thank you. Well, as I said at the beginning, I'm really glad that we're letting the community hear about this service. So thank you very much.
Councilmember Hedigadis.
On a similar note, I just want to thank staff for the work they do, and also want to plug the fact that it is the upcoming 150th anniversary of the Human Services Department here in Evanston, which is really exciting and something I didn't know. That's kind of amazing that that's been happening here in town for so long.
Councilmember Reed.
Yeah, following up on some of that. So you mentioned that there's a website where folks can get access to all kinds of things. I've never heard of that before now, as Councilmember Revelle said. And so I would just really love to see us, get this out in the community. If there's a blurb that you all can write up, I'd love to put it in the 8th Ward newsletter, and I'm sure my colleagues would as well. And where can people get tested for free in Evanston? We're familiar with Planned Parenthood, which also for the folks out there is not just for, for women, it's for men as well to receive all kinds of services. But so we don't have Planned Parenthood in Evanston, but that I know of.
Thank you so much for that comment. So folks, if they have a healthcare provider that they like, they can feel more than free to ask for STI screening. It's part of sexual wellness is health. If they don't have a provider that they like, we are fortunate enough to have 2 federally qualified health centers here in Evanston. And federally qualified health centers are essentially places where folks can seek access to medical care regardless of their residency, regardless of ability to pay. And so we work really closely with our federally qualified health centers, and they offer fantastic sort of holistic health services that include STI screening. So.
And just particularly for the media, I see 2 folks here from the media. Can you name those 2 places, and if you want to write it in your story?
Yeah, we've got Erie Family Health Center and Access Community Health Network, both in Evanston. Got a number of other fabulous clinical partners, but those are the 2 places that see folks regardless of their ability to pay.
Thank you.
Yeah.
Dura Ogbo.
Yeah. Regarding dissemination of information, we try as much as possible to include communicable disease efforts in our newsletter. And if you have any ward meetings that you want to invite us to, where we can speak more about communicable diseases, we'll be more than welcome to offer any education needed. And also, if you have newsletters that you want to have our information embedded in, we can also provide that information as well. So these are tools that we have used to disseminate information regarding the fabulous work that our Communicable Disease Unit offers.
Thank you. Thank you, Councilmember Burns, or whoever brought this up.
Yeah, I have a few questions, but I probably should have started with this. But this issue came up in a conversation I was having with a constituent. This particular constituent was questioning whether or not the city was doing enough to address communicable diseases. That led me to reach out to Director Ogbo with a line of questions, and then we both thought it appropriate to schedule some time where we could get a report. And to that point, is this a regular update that this committee gets?
If I can recall, I think this is the first update that we receive. There are a number of updates that we provide this committee, one being general assistance, which
Absolutely.
we provide on a yearly basis, and our rodent control as well that we provide. I believe that was the time when we provided an update on a yearly basis, but this is the first time with communicable diseases.
Yeah, so unless there's any objection, I think this would be a good report to add, you know, as a, I don't know what cadence we think is appropriate, but Councilman Reed.
Maybe an annual report. I don't know if I'm sure there's a month or a week or something that might align with it, or a day somewhere. So,
Director Ogbo, would that be?
Yeah, absolutely. A yearly report will suffice.
Okay. And then also, can you make this, the presentation available? I don't know if it was in the packet. I didn't see it in the packet. Maybe I missed it. But if you
included in the packet.
if you can share that with us, I did provide, I emailed some information that I had previously received from Director Ogbo to everyone here. So if you go on your email, you'll see some of the data that was mentioned today. And if we can include that in the packet, just so if a community member looks this meeting up and looks through the packet or the minutes, yeah, that'd be great too. Perfect. So that's 2, 3. I don't think I've ever heard of Access Community Health Center. Where are they located?
On Howard.
Is it Howard?
Mm-hmm.
Okay. But that's good to know. I knew Erie Health, Center. I knew that was going to come up, but I didn't know about Access. Is that in Evanston or Chicago? It's in Evanston? Okay. Okay. And then what else are we doing for prevention? I heard one strategy in terms of making sure people are under care and receiving treatment, taking medication, but is there anything else we're doing in terms of prevention?
To help folks with prevention, we talk to them about like what is safer sex and what supplies are available, and we provide those supplies for free to residents that request them. We do a lot of like risk reduction activities, so talking with folks about ways that they can sort of limit or reduce the risk of encountering STIs or HIV infection. And we do that work sort of broadly with the community at events. In the e-newsletter, we sort of market the availability of these free supplies, but then we also do it one-on-one in conversations in response to infections. So like the first half of this presentation, we become made aware of infections that are diagnosed, and then we follow up with folks. And part of that follow-up is giving them this sort of information, health education, and risk reduction so that they can not only receive that adequate treatment and stop that chain of infection, but also prevent future infection.
I guess the question is Director, maybe the Director, but do you feel like the division has the capacity to engage with people before we're made aware of them through these types of reports? Or
Formally, I will say no, because the team only comprised of one individual. And in the course of 3 years, we've expanded the team from one individual till now we have 4 individuals who are working in the team. Unfortunately, COVID happened, and it definitely indicated the loopholes that we have in our response. And that was pretty much the catalyst for us to bolster the communicable disease unit. So as of right now, I would say that we're quite comfortable. And we always evaluate our program to see where they are deficient to plug in those holes. And in the future, if we need an additional staff member, I'll be coming to the city council to make that request.
And I guess what I'm saying is obviously we want to make sure that if we can, no one ever has an STI. And to do that, we want probably them out at different events and maybe other places sharing this information. I'm sure people are receiving this information if they have a primary care physician and, through other means. But I guess the main thing is wanting to put them in contact with some of the agencies that we work closely with in the community to maybe have a table at an event or just to get the word out about this service. Because if some of us were unaware of it, it's possible that many community members aren't aware of
Absolutely.
some of the services that are being provided. Yes, please.
We also have a table at the library and at
Oh, good.
our Robert Crown Center where we talk to folks and have these conversations.
That's excellent. Yeah, those are the types of outreach that I was looking for. That's good. Thank you. Councilman Reed.
And I'm sorry, while you're there, I'm also thinking about, having to request some of these supplies. I know, for example, like the Center on Halstead, there's like a big basket sitting there with all of these supplies, and you don't have to talk to anybody, interact with anybody, you just grab it and go. And, I'm wondering if we have that available either here or Robert Crown or other places where folks can get these supplies without having to interact.
Yeah, I just want to say that I appreciate the sort of emphasis on like that shame-free accessing as needed, and I think it's really important. Right now, we don't have any sort of free out in the public, just like jars where you can grab them, but certainly that's important and something that we'd love to work towards.
If you need a few dollars for that, the council can maybe get you guys some money.
I'm also interested in understanding the data that we saw. So, and if we could pull that, I don't know if we can pull that back up in the slide, but I'm wondering, is that so? From year to year, are there people who were reported one year that we're also counting in the following year, or is that all new reports, new people?
So important about all the top three conditions is that they can be cured. And once they're
Right.
cured, folks can be reinfected. So this doesn't necessarily speak to discrete individuals. It speaks to discrete cases. So each of these were sort of met this case definition that Elizabeth mentioned. So this is a new case. So there might be, a single person who had an infection that was treated, cured, and then got another infection. They might appear on 2021 and 2022, but these are new incident cases,
Okay.
new diagnoses listed on this table.
Okay. And then we're following up on each case.
So we follow up on each case. The nuance there is that we follow up on each case diagnosed or treated in Evanston, regardless of where they live. So these are folks who are living in Evanston and who have been diagnosed with chlamydia. If they saw a provider in Chicago and were diagnosed in Chicago, Chicago will follow up on them, but all cases are followed up on. The nature of the follow-up depends a bit on the condition. So some folks, we just check in with the healthcare provider to ensure that they've received that adequate treatment and they've got a cure. Whereas with other folks, we will do like direct outreach to the resident to make sure that they understand their diagnosis, they understand the nature of the treatment, and to provide that health education and that risk reduction that they are deserving of. And all of our work is confidential and is voluntary. So if folks receive the call from the health department and they choose not to, continue with that conversation, that's okay. But our follow-up has been sort of offered.
Okay, and I just want to make sure I understand. So in some cases, we follow up directly with the individual, and some is to the medical provider?
Exactly right.
Okay. Are we keeping track of our contact rate? I would imagine in some cases it's hard to get a hold of people. Is that something that we track?
Yeah, like the rate of folks that we reach out to, that we reach.
Exactly.
I think internally we keep track of our attempts to reach folks, and that's documented as part of our case follow-up. So certainly not numbers that I have off the top of my head.
It would be, I think, helpful to have that information during maybe our first annual report that we do next year. But just curious. And I guess just anecdotally, do you find it difficult to reach people or?
I think reaching folks is feasible. Oftentimes, you know, the healthcare provider, as part of their mandatory reporting process, has a phone number on file. So we have a phone number to reach the resident. I think, much like you all were surprised that we do this work, residents are surprised that we do this work and that it's work that is required of us. So it's part of the reason that we're really appreciative of this opportunity to be here, because we don't want folks to be surprised by our attempts to reach them. We certainly don't want them to be alarmed by our attempts to reach them. And we do want them to know that it is completely confidential and voluntary. But that's not something that you can communicate in the first 20 seconds of a call.
Right.
And unfortunately, we all get those spam calls all the time. So I think folks might not know that.
You get hung up on a lot? Is that what you're saying?
Yes.
Okay. Yeah. Okay. I'll follow up with you on that offline. I've done a lot of cold calling. I was a campaign consultant for many years, so I think I'd like to work with y'all on that if I can. But thank you so much for this report. We appreciate it. Any other questions before we move on? No questions. Thank you. I think we moved this, so we probably have to.
Yep.
Yeah. So let's do roll call. Or no, I'm sorry. Councilmember Harris is with us but not able to vote. So all those in favor of accepting this report and placing it on file, say aye.
Aye.
Any nays, any abstentions? All right. Again, thank you.
I'll move item.
Next up.
I'll move item HS1, beekeeper review and follow up.
I'll second.
Been properly moved by Councilmember Reed, seconded by Councilmember Hedekadis. Is there any questions, or should I? So I guess just for my own benefit, Director Obo, I think it would be helpful for us to understand what the recommendation was from the
Entomologist.
And how we received that recommendation and all the communication about said recommendation. And I was able to find mention of it in our last packet. I'm trying to quickly pull it up now. Mm-hmm. And I don't know if this was pulled from an email or if this was part of something else, but I'll let you start and then I'll try to pull this up.
Yeah, absolutely. The recommendation of the Human Services Committee in November of 2023 was to move the hives. After consulting with the entomologist, she offered the recommendation as a social compromise. Her email explicitly stated that she cannot make a concrete requirement to move the hives if she does not know what stung the individual. So based on this information, her recommendation was a social compromise where the bees will be moved. Whether the bees are moved or not wouldn't make a difference based on the information I gathered. From an insect perspective, it wouldn't matter. But based on what she stated, she just wanted to reach a social compromise regarding this matter.
Do you have that email available by any chance?
Yes, I can send it.
Yeah, if you could send that around, I think it would be helpful for us to just read exactly what was said, and then I'm trying to find this other. And if anybody has any questions, I just feel like this is, at least for me, the bottom line as it relates to this particular matter is what was recommended. Here we go. So what I saw, and I don't know if this is an email, Director Ogbo, but it says it was point 3, I think this was the report, but it says, I examined the property. I think this was by Brittany Buckles. Is that her name?
Yes.
So I examined the property to find an alternative location for the hives. Where they are now is close to the pool, but the hives are faced away, creating the flight pattern away from the pool. If Mary wanted to move her bees off site, which she told me she does not, I could help her find a close community garden that could allow her full access potentially and help relocate them in April when the hives are at their lightest and easiest to move. With one overwintering inspection left, less invasive than the one I conducted today, the bees will be at their least defensive state until April. So to me, what's most important about that is just that first part. Wasn't really a recommendation, but Brittany mentioned that she had examined the property and found an alternative location for the hive. So that's Exhibit A. And then your email.
Yeah, I just forwarded the email
Okay.
to everyone. And the email that you just read was
that an email
that
or was that a part of the report?
That was part of an email.
Okay.
The information that I just sent to you is the most recent information that I received from the entomologist, where she said she had to reach a social compromise, and that's why she recommended moving the hives, but it wouldn't make any difference either way from an insect perspective or flight perspective.
Yeah, so this is again Brittany Buckles in an email. Was this today? No.
That was in May. That was
May 7th?
Mm-hmm.
I see May 7th. But either way. Good morning again. Without the specimen of what stung the neighbor, I cannot identify it. I suggested moving the hives as a social compromise if you needed one, not from an etymological perspective. Bees fly 2 miles on average, so relocation on site won't change much from an insect perspective. However, without a specimen, I cannot know what stung the neighbor. To be clear, Nisi has been beekeeping for a long time, and the beekeeping community knows her. I would be comfortable giving her the benefit of the doubt over the neighbors, but without the specimen in it, only a gut feeling. Yellow jackets were reported on the neighbor's side as well. We really do not know if it was Nisi's bees or the natural yellow jackets living on the other property closer to the victim. So that's the information we have. And what do we want to do next? Anybody?
I got my light on.
Oh, I didn't see that. Sorry. Who was first?
I was first.
Councilmember Reed.
I'm sorry. Just for, because it seems like based on that there's going to be another story about this. So what are we being asked to do today?
Whether to deny or approve a license.
I'm sorry. I feel like we've been here so many times with this. Have we not already approved the license?
Well, based on the past information that we received, there was a direction that after the bees have been moved, so that this can be returned to make that determination. We were supposed to return in April, May of this year, but due to a number of factors, so the meeting kept being moved. So here we are now.
Okay. Well,
and real quick, I think another way is we may have approved it or said we would approve it with a condition, which is what the condition is what we just talked about. That's why I wanted to start there.
Yeah, and I don't think even that was a condition, because it's very clear in this email that and from everything that's been said, if you move the bees, it's not going to change anything. So, and it also was it didn't seem like a mandate. It seemed like, hey, this is a social compromise, not a mandate or not. So
I don't know if that was known at the meeting, even if you just look at the date. I think that's somewhat new information, which
Sure.
we can interpret this in a different way. But at the time, I don't think that was known. And so we took it as, all right,
At the
this
time,
would be
what
helpful.
wasn't known?
When we discussed this in November.
Oh, okay.
Yeah.
Yeah, but as far as what I think was presented to Ms. Nisi, it wasn't a mandate that she move the hive. It seems as though, I think what I heard from the neighbors is that there hasn't been a new stinging incident in the interim. You can maybe head nod yes or no. No. Okay, so there hasn't been a new stinging incident. We need the pollinators, so I would move to approve this.
Councilmember Hedekadis.
Yeah, I haven't heard anything today that would change my yes vote on the licensing. For folks that are watching online, I would just give a plug for the city's mediation services. I feel bad that it's gotten to this point, but we have a great staff that can do mediation. I've done this for residents, and I think it's important to come to an understanding before we get to escalated situations. So just know that that's out there. Thanks.
And all I will say, I agree. I think this is something that we should approve. All I would say is the next time we get a recommendation, I would like them to just be very clear on, because a no recommendation is fine too. Hey, I reviewed this. I think they've done everything they can do. But I do think it was a little confusing, to get a recommendation to move the hive and then through another email suggest that it was a social compromise. I don't think that's what we were looking for. I know I wasn't looking for that. I was looking for an expert to tell me exactly what could or couldn't be done in this situation. And so no more social compromises, at least if I'm chair. I just want, what is the recommendation based on my expert opinion? But I agree. I think we should approve this. Councilman Ravel.
Well, excuse me. I was intrigued at Ms. Nisi's comment earlier today that if she moved the hives 2 feet or whatever, then the bees wouldn't be able to find the hives when they return. So I guess I'm confused about why the entomologist even suggested that as a social compromise. So
yeah, I thought that as well. I didn't bring it up because I don't know at this point how useful it would be. But
well, and we have no expertise up here to be able to evaluate that. Yeah. Yeah. Well,
I think we did reach out and see if etymologists could be available, and I would imagine and we only reached out today, so it was very short notice, but maybe we can get that response in the future.
I invited
at a future meeting
previously.
Oh, you did?
Not for this meeting, but for the former meeting we had. But her schedule wouldn't allow so. But in the future, I'll keep that in mind.
But maybe we can get an answer from her on that question, though, because that may help us as we review kind of future complaints.
Okay, absolutely.
Right. Anything else, Councilman? Councilman Reed?
I'll just say point of information. What I recall hearing is that you could move it 2 feet, but beyond the 2 feet, if you're going to move it 5 feet, is what I heard, that you want to just move it 2 miles because so that's what I heard. You can move it just a few feet or a couple feet, but not more than that is what I heard. I don't think no. All right. Yeah.
Okay. So, yes. Okay. So this has been moved and seconded. This is for action, presumably, or should be to approve the license, correct? Okay.
And I want to just clarify my motion. I move approval of the license.
Yeah. Okay.
I didn't say that specifically.
Okay. All those in favor?
Aye.
Aye.
Any nays? Any abstentions? All right, the ayes have it. Can someone move HS3?
I'll move item HS3, ordinance 41024, amending Title II, Chapter 14, Citizens Police Review Commission to add powers and duties.
Second.
It's been properly moved and seconded. And just a quick point on the last thing. This goes to council, or we have authorization to approve?
Yeah,
That's how this
it does
okay.
go to council.
I just wanted to provide that for everyone who came here today for that issue. So the license is approved. All right. Okay. HS3, somebody moved HS3, right? It was moved by Councilmember Reed, seconded by Councilmember Hedekadis. Do we have a presentation?
Commander Glue is in.
Commander Glue.
Chair Burns, members of the committee, thank you very much. I don't really have much of a presentation except for I'll go over what was written down in the memo. And obviously, if there are any questions, I will answer them as best as I can. So as we know that a couple of years ago, I think approximately 3 years ago, we went into another iteration of police oversight, and that was with the Citizens Police Review Commission. That came with we basically launched a whole new committee with a new ordinance, and that committee, like I said, has been going for about 2 or 3 years now. With that knowledge and experience of having this committee reviewing a number of investigations, we have cooperatively worked with the committee to make some adjustments to the ordinance that we think are, one, going to make it more efficient and effective, and also I think that it's probably a little bit more reflective and inconsistent with how the committee is actually operating. Like now the letter is probably a little bit more consistent with the intent. So like I said, these recommendations, these changes came from both sides of the equation, the police department and the committee members themselves. One is talking about training. We think that before somebody comes in and assumes this role of police oversight, there should be a certain amount of training so they have an understanding of what the investigation is, what the police department does, what the oversight is, and things just basically, so just not starting cold. One of the largest, I would say, impactful pieces of evidence we have in these investigations is the body-worn camera footage. We felt that we had some struggles early on having committee members review the body-worn camera footage. Therefore, we weren't meeting the goals I think that we would have wanted, right? A thorough investigation to see its complete objective. If we're not reviewing the material body-worn camera footage of these investigations, we're not achieving that. So that has been put in the ordinance, that the committee will review body-worn camera footage as material to the investigation. Also reviewing the investigative files. We had some concerns that maybe the files were not being completely reviewed. Again, that would be inconsistent with what everybody's trying to collectively accomplish with this committee. So we have put in there that the files will be, one, distributed in enough time for them, ample time to be reviewed, and that is the responsibility of the committee members to review them. Remedy for an impasse. So we have had investigations where the police department feels that they have done everything that they can to make it thorough, objective, and fair investigation. And the committee has not seen it that way. That has put us in an impasse where almost the investigation will just ping pong back and forth between the department and the committee. This puts in there that the committee can send a investigation back for a second review if the department feels that we've objectively addressed that, but the committee still has concerns. They can move that forward to the chief of police and author a memo or a letter outlining their concerns for the review of the chief of police before she or she in the future makes a final determination, disposition of that investigation. And finally, there have been some, I think, minor language adjustments, again, that make it more consistent with how we're operating, such as we changed. One example would be the original ordinance said that you could not be related to somebody who worked for the city and sit on the council or sit on the committee. In Evanston, that's a little tough sometimes if you're pulling people from the community. So we changed that to the police department. You can't be related to somebody who works for the police department and sit on this committee. So that would be an example of a minor language change that we made. So that's kind of the rundown. So with that, I will open up. I will answer any questions.
Yeah, before I go to questions, I just want to make sure we all understand. So how did these recommendations come about? Was this what
They kind of
initiated this?
They kind of spring out of so it's like anything. You have something, you conceive it, you want it to operate a certain way, you have an intent, and then you kind of put it into practice, and then certain things are revealed that it's not operating as intended, and those adjustments. And basically, that's kind of the overall philosophy behind this. we needed to make this, I think we need to make this ordinance better to achieve its goals. And like I said, again, professionalism, effectiveness, and efficiency. So like when we see, we would carry out our duties, and then we would see, well, here's a weakness, this needs to be addressed. Or this was something that wasn't anticipated, we need to fix this. So it just comes from, I say, about 3 years and a number of investigations that we've done where we see that these are areas for improvement.
But did any of the commissioners propose these changes, or police department, or both?
I say we did this in cooperation with the committee.
Perfect.
Especially the present iteration of the committee members now. We have, like I said, it was definitely, definitely done together.
Perfect. Councilmember Reed.
Thank you. Speaking of where this came from, was there a referral made on this? Who?
You want to come to the microphone, Allison? This is Allison Lepsinger, our policy coordinator.
Policy manager.
Did I get that right? Manager.
Super close. Good evening, everyone. It was, I'd have to go back and look, but yes, we did a referral. It was maybe, it was like March or something. And it was the city manager and 2 of you. I can't remember which 2. I'm really sorry. Yeah, maybe the mayor and Councilmember Harris, I think, if we remember correctly. I can go, you think maybe Councilmember Kelly? Okay, yeah.
Okay, that's an
I
interesting
can go and
bunch for
look.
this particular thing. Yeah, so also I'm not seeing the language specifically where the change to, you mentioned that folks couldn't be related to anybody on the council or working for the city. I don't see the specific change where it says now just the police department.
Like I said, upon my last review, when we sent to legal department, it was there. If it's not there now, last time I checked, we will make sure that adjustment is made prior to the council.
Yeah, thank you for that. And so I just want to make sure that is in there. I also think that we're missing a key constituency who should be reviewing this. I think, there are groups of activists out there. I'm thinking of the Citizens Network of Protection. I'm thinking of Evanston Fights for Black Lives and, some of the police accountability groups that are local that I think should have some say in this. We often talk about kicking things to key stakeholders, and I think that's a key stakeholder group that should be engaged for this.
And for this, I just want to make sure, what do you mean by this for the record? Engaged
Any changes to this, to the Citizens Police Review Board? I think there are potentially more. There could be more changes. There could be slight tweaks to what is being proposed, but I just think those groups should have an opportunity to review this and be engaged in the process. I'll also say that, the training component, I agree that I think training makes sense. I do worry, I would almost want the training to be conducted by some outside group that is not the Evanston Police Department, just to create some, just to make sure that there isn't a perception of, to make sure that there is a perception of objectivity in the training. Thank you for that. That's a better word than what was popping in my head. I think, I'd love to see that. And also, I wonder if, I think this committee is currently staffed by the Evanston Police Department, correct, by our OPS?
Yeah, so as of right now, it is staffed by the Office of Professional Standards. At some point, and then there was the city manager's office had a representative in there who was deputy city manager Dave Stonebeck.
Oh, okay.
Now that we have gone down, since we were down to no deputy city managers, I was acting in that capacity.
Mm-hmm.
Now that we have some deputy city managers, we will be gravitating back towards that staff member for the city manager's office will be one of those deputy city managers, not a member of the police department.
Yeah, thank you for that. I also wonder if we want to, again, to create a true separation, if similar to our ethics board, we want an outside counsel to serve as the staff for this committee, to help advise the group with, give them legal advice. Do we have someone from the law department that staffs this at all, or? Because I mean, some of these questions are legal questions, and I think there are a few more tweaks that could be made to this. I would actually move, not at this moment because I see there are lights, but I would move to table this to a future meeting, just to give us some time to think about, one, to give us some time to engage with groups that I think should be engaged, but two, to make sure that we're, since we've opened this up, I think, it's time to make sure that we are following some of and not to say that the police department and the group hasn't already done some of this, but I think just giving more time for looking into best practices, and some of the learning that we can look at from other communities who have engaged in this process, I think would be helpful.
Before we move on, has any of this been implemented already, just as a practice, or are you waiting for it to be adopted?
Well, I think one of the things that necessitates these changes, or we feel it necessitates these changes, is like, again, when we went through this process before, crafted the ordinance, once you put it into practice, it's gonna operate a certain way. And some of these changes are basically to make this, when you put it into practice, it's kind of take on a life of its own. And this is making the adjustments to make practice and letter and intent all consistent.
For sure.
So,
but has any of this been implemented so far?
As far as people, as far as like we are requiring people we are heavily encouraging that people read the investigative files. If our committee members who are responsible for making determinations on if this is a fair, objective, balanced investigation, if they're not reading that file, then they can't do that.
Oh, I'm sorry, I read this wrong. So they have always been this information has always been made available to them. Now there would be a requirement that they actually review it ahead of the meetings.
Yeah, so I think that probably when this was originally crafted, everybody that kind of put it together would think that, okay, well, this is just a given, right? You're given the stuff,
absolutely,
material, people are they're just going to do it.
Yeah.
And I think that we discovered that's not necessarily the case.
Okay.
So having some additional language in there to direct the committee members that this is the expectation and the requirement. And plus, having that ordinance, when we bring other committee members on, is something we refer to as like, this is the expectation that goes with law being appointed to this committee.
Yeah, no, I got it. I read that completely wrong the first time. So I'm glad I asked that question.
I would say it's a little confusing.
It's just kind of mandating participation, which I like that. Director Ogbo and then Councilmember Hecadis, did you have something?
Just to attest that this went through the referral route. It was referred by City Manager Stowe, and the co-referrers are Councilmember Harris and Councilmember Kelly.
Okay. Councilmember Hecadis.
Yeah, so when, Commander Glue, the one question I have when I was reading through the packet and it mentioned, the court requirement to look at the body worn camera footage, which is very important, right? I'm just curious, how do those committee members get access to that? And so if you can just explain that procedure.
So we will, as part of the investigation, we will have the body worn camera footage that's material to the investigation, the allegation itself. That body worn camera footage will be appropriately redacted. And then we will move into executive session, and the committee members will review the body worn camera footage in executive session. Then we will move back out and we will have a discussion about the investigation, and then, motions will be made to either hopefully move it forward as fair and objective, or, hey, we have this concern, we would like it looked at a second time with this in mind.
Okay, and so it seems as though, obviously they move to private to watch the video, but then they also have the opportunity to go back and review certain sections if they need refreshers about.
Yeah. I said, maybe I'm going to back up a little bit. So we talk about ample time. So to review the investigative file. So approximately we try to 2 weeks before the meeting, get the committee members the appropriately redacted paper files, for lack of a better term, they go electronically, memos, reports, so on and so forth, that they can review. Disposition, rule violations, or whatever goes along with that investigation. They'll be given that 2 weeks ahead of time, and they can review that. Then when we have the meeting, we move into executive session and we review the material body-worn camera footage. And then we come back out and we can discuss the investigations. So 2 weeks ahead of time, get the file. Sometimes it's short, sometimes it's over 100 pages. And then during the meeting itself, people can review, the committee members review the body-worn camera footage.
Any other comments, questions? Councilmember Ravel.
Well, I would just say that I think these changes make really good sense, and I'm pleased to think that the commission is going to have those, codify those changes.
I think that I would characterize these changes as basically what would be an evolution, right? We start one place, we go into practice. With experience, we make it better. I think that the current committee members take their work collectively. They take it very seriously. The last time we were able to review, I think we have one vacancy now, but the last time we appointed people, we actually were able to find 2 individuals that had this work in other agencies. So one of our committee members had a similar oversight role at New York Police Department, for the New York Police Department. And then one of our other individuals I think came from the Attorney General's office. When we talk about law, we have, I believe, at least 3, if not more, practicing attorneys in practicing in some way on this committee. So the first iteration of this committee did very good work, but they were new. It was a new ordinance and kind of a new mandate. We are now into, I think, the second or third evolution. Committee members, we were able to, I think, get really people that bring a good perspective, good experience prior to this, and like I said, worked with us to make these changes or propose these changes.
One, I don't know if we need to hold it. I am just personally want to see these implemented, and I think along the way, if we have anything else we want to add, we should do that. But I think we'll have enough time between now and council to do it. I've always noticed that when it's someone's proposal that they want to move forward, they don't hold it, want to hold it at committee. And if it's something that they didn't, develop themselves, they want to hold it. But I want to remain consistent. And I think I've heard you say this with your own referrals before. We'll have enough time to discuss this in between meetings. It'll require at least 2 readings at council, and then also at council we can table. We have options there. So that's my first comment. Second comment is not directly related, but related. I'm glad we're discussing this. To me, I want to not only talk about the process that the commission is involved in, but also our role. I would love for us to be able to see the dash cam and body worn camera videos as well without having to go to the police station. And so as I've sat here to think about how we might be able to do this, maybe we can come a little earlier to Human Services Committee for those who are interested, and we can watch them in the library, similar to what the commission is able to do. I don't know if that's something that makes sense to you, but I know the reason why I'm bringing this up is I had someone reach out to me not long ago about a situation she was involved in. She filed a complaint, and she was not satisfied with the outcome of the investigation. When I look back at the investigation, I noticed that there were no, recommendations for any discipline or training. But when I reviewed the body worn camera footage, although I mostly agree with the recommendations or the opinions, the police chief and everyone else involved, there was one thing in terms of training that I would have brought up if I had an opportunity to see the dash cam footage or the body worn camera footage. And while we have an opportunity, someone like myself who's very busy, you got to like schedule a separate day to go out and watch it at the police station. I would much rather come in, 10, 20 minutes before our human services committee meetings, not something that is mandatory, but something that we make available for committee members that would like to review that footage on the day of the meeting. I think that if that works, I'd love to implement that moving forward.
Point of order, or not point of order, point of information. This is all FOIA-able information, so I don't even think we should have to come in 10 minutes early. There's no reason, I think, that a link through evidence.com or whatever we're using now couldn't just be sent to us and we can watch it at the same time we're going over the packet.
To say a link, but I was anticipating
Well, I mean, I think everybody
some
here.
pushback, so I tried to find a compromise.
Yeah.
But obviously, a link would be.
So, I mean, I think
even
everybody here has
easier.
a valid point. So it's just trying to bring it all together. And so, with the caveat of my assessment may not, could be vetoed, at some other level within the department. We do send stuff out via FOIA, but I can't opine on what we're going to let out of the police department without some type of tracking as far as where it's going. We are very diligent of putting what information goes out of the police department documents in next request. So how we do that, not necessarily trying to tie it up or diminish our customer service. There's that aspect of it. I think sometimes, Councilmember Burns, sometimes it's, if it's immediate and somebody needs to know right now, it's like, hey, come on into the police department. Let's sit down. Let's get people the information now. And I think that's a lot of times when you say like, that's probably be the quickest, most immediate. Versus what you're saying is like, hey, listen, I have this question. Is there any way I can have somebody present? If it's not that immediate, I don't necessarily see where that would be a heavy lift. But again, that's my assessment. It could be vetoed at another level.
Yeah, and I don't want to spend much more time on this. I guess what I'm requesting really is just something that's built into our process. Maybe it's upon request, but I just know the report is one set of information, but without seeing the body worn camera or dash camera, we're solely relying on what is written in the report as opposed to what we can, what actually happened from, watching the video. So I would love to, if we can figure out how to, if it, maybe it's upon request, if one member says, hey, I want to, review dash cam, body cam footage, at the next human services meeting. Maybe after we see the packet, someone sees something like, I'd like to review the video. Then maybe someone can come a little earlier, or we can, consider providing a link, some protected link where we can access it. So again, a side note, but something that is really important to me.
Like you said, if those questions come up, I would definitely say coordinate with the chief of police so she can review, make determination if staff's available and so on and forth. She would have the ultimate say.
Okay, that's good to know. Councilmember Reed.
Yeah. I'm going to move to table this to our November meeting. While I appreciate your comments, this committee and many other committees that we all sit on have made it a practice that when key stakeholder groups are not engaged, that we table things and we give time for those groups to be engaged. Everyone here has voted to do that before on issues that, as you said, were not ones that they brought up. I'll just have to express that I think I've made it quite clear in my time on council and on this committee that issues relating to policing are something that I pay close attention to. So I'm a bit disappointed that I think I'll just say this publicly. I think the city manager needs to, whenever he's making a referral, just reach out to everyone and, not hand select council members to make referrals with. It needs to be every council member, here's the referral I'm thinking about making. Mayor Biss often does this. If you'd like to sign on, sign on. That way we're engaged early on in the process. And, you know, this is, you know, when we received the packet a few days ago, it was my first time seeing this. And so I just think one that needs to be common practice when my colleagues up here do it. We're political animals, so that's different maneuvering. But certainly from the city manager, I think we all need to have an opportunity early on to engage with this. And I'm not seeing anything in this now that as it's drafted now that seems immediate, right? It seems like what I'm hearing from you is that there's a good cohort on the committee, on the commission now. And so the requirements that they, you know, review these materials, you know, may not make a huge difference. I also don't know how you force people to review stuff. And I don't know if I don't think I saw a penalty if they don't review the materials. And how do you judge whether they reviewed it or not? So I think it's nice to put it in here, but I do think that, you know, there are, you know, when you open something up, you open it up. And I think we should take a bit of time to really dig into this. And so I'll move to table this to our November meeting. I will engage in between now and then. I think we'll be able to move quick then and get this passed before the end of the year at council, likely at our meeting in, you know, our meeting in late November and early December. We'll likely be here for budget anyhow. So I moved to table this to our meeting in November.
Is there a second?
The chair is able to second.
Well, I think I made my position clear on this. I think we can. I don't want this to. Well,
again,
it hasn't received a second, so
well,
we can.
And I'll just close. I mean, this is the place where if there are going to be major changes at council, I don't think we need to get bogged down with making tweaks to this at council. I think committee should send forward the best possible package. And I'm honestly disappointed in my colleagues to my left and my right and all around here who have engaged in, when it comes to business owners, when it comes to folks that are not young black and brown people who are disproportionately impacted by the policing here in this town. Folks are always gung-ho to hold stuff and to make sure that key stakeholders are engaged. And so to now, for something that doesn't present as an emergency for us to rush through, to not give that leeway to to table this for a bit, to engage those communities seems hypocritical to me. And so I'll just share that.
Councilmember Hadikatis.
Just a quick comment on this. I personally like the changes that are being made here, and I feel if there are other changes additionally, I'm more than willing to work with the outside, you know, constituencies to include those and, you know, possibly co-sponsor a referral. So, but I think these are good changes, and I'm comfortable moving them forward.
Yeah, and what I'll say is I think I'm comfortable holding and tabling this at council if need be. I think because none of their co-refers or the city manager are available, I would love to hear from them about. I'm sorry?
Councilmember Harris is here.
If she wants, well, it's also getting late. We need to move on to that. But my point is that it sounds like City Manager Stowe made the referral. I would imagine that he's interested in getting these approved and not necessarily kind of spiraling into a whole nother discussion about other issues that may be important, may need to come up in a 7 referral, may even need to come up at council, but I would at least like to allow him the opportunity to talk about his intentions around these changes. And I just personally think while we can hold things at committee, we have those same tools at council. So let's use the time in between, unless there's a second, let's use the time in between the meetings to get whichever stakeholder groups involved and see what changes they may have. Councilman Ravel.
Well, just having served on the referrals committee since its inception, I don't want to try to put words in the city manager's mouth, but oftentimes a referral is made because we know work is being done on an issue, and we want to make sure that that we've taken the steps to make sure that it's going to be appropriate for it to come to the appropriate committee or council. So it's more of it's not because the city manager or the co-referrers had any particular issue in mind. It was more knowing that the commission was working on these changes and saying, well, let's make sure that when they're ready to present it, that it's going to not get it stuck because a referral wasn't made. So I think it was more, oftentimes these things are just procedural.
All right. So this is HS3 for action. So all those in favor?
Aye.
Any nays?
I'd like a roll call.
A roll call, please.
Councilman Harris,
Aye.
Councilman Reed,
No.
Councilman Ravel,
Aye.
Councilmember Burns.
All right. Oh, she's not. She can't vote today. Yep.
Well, I was going to make a comment because my name was called.
Yeah,
Whenever
absolutely.
I'm called, I will answer.
No, please.
Yeah, so I think what Councilmember Ravel stated is the facts that it was brought to our attention that there was a need for change to clear some language up, to clear some expectations. And so I served as a co-referrer. And if I'm correct, I think it came through Councilmember Kelly. So I cannot make the assumption that the appropriate people weren't invited to the table to have stakeholders have say in that. I think that's an assumption, unless you know that, Councilmember Reed,
I know
that
it.
any of those individuals weren't part of any discussion directly or indirectly. So I'm not sure.
All right, let's get thank you, Councilmember Harris. Does someone have a motion for HS4 under items for discussion?
I move for discussion HS4, adjusting general assistance, emergency assistance programs, and the use of assistance funds.
Second.
It's been properly moved by Councilmember Hedekadis and seconded by Councilmember Reed. Councilmember Hedekadis, I think this was first.
Sure. So I appreciate staff's feedback in the memo about other municipalities and their the potential use of general assistance funds for assistance with property taxes. While I appreciate that, that's a really big burden for folks and that this would be a potential help, I don't see how we could I'd like to follow the staff's recommendation of not including that as a usable expense when receiving general assistance. One thing it did make me think of, though, and that oftentimes when people fall upon hard times, in relation to property taxes. I've had like one case where a family came out and it was actually very late in the process. And looking back, I was like, I wish we would have known of the family's difficulty like 2 years prior. Right. So, rather than change our general assistance programs, I would like for us to figure out a way that we can do a little bit better outreach in regards to exemptions and property taxes in general. To kind of get out ahead of that. I don't really know exactly how we would do that, but, I think that's something going forward we can kind of brainstorm on and think of a way to kind of looking at, property tax data and finding out where potential, people in need of help are. I think that might be a a better use of our efforts. Thanks.
Councilmember Reed.
Thank you. One thing I think we need to explore with adjusting our general assistance and emergency assistance program, it's we see that Chicago is making this move, and I think a lot of advocates are suggesting this, which is we have a refugee resettlement fund, a migrant resettlement fund, and other communities are looking at combining those some of these funds into one fund and having one unified. Chicago's looking at more of a unified shelter system, but I think the unified system, I think we should really look to create similar flexibility in our general assistance program as we've had with our refugee resettlement fund. And so I would really be interested in looking into how do we unify those systems as much as possible to create a larger pot for both communities, and so a larger pot that could help our migrant population, our refugee population, and then also for folks who are, residents of Evanston, citizens, how we can create more flexibility within this pot of money for, all of the potential exigent circumstances that could present themselves. I also would like to, it says that the rent stipend is $600. The proposal is to raise to $675. And there's a suggestion that Evanston has one of the highest rent subsidies. I forget the exact language that was used, but rent subsidies in the state. I'd love to see how that actually compares to other communities and where that, how that determination was made. But I would also say that Evanston also likely has one of the highest rents in Illinois as well. And so I think those two things match up. And also, I'm wondering what the goal is with the rent subsidy, because I don't know if anyone who's paying $675 for rent. I got lucky maybe 7 or 8 years ago. I don't know, a while ago, and I think I found a place that was under $1,000. But that is rare and probably non-existent nowadays. So yeah, I think that we should be basing. I want to understand what we're basing that 600 or the 675 on. Is there a formula? Are we saying that we only want to cover 50% of someone's rent? Are we, and I don't, unless you have an answer for that now, go ahead. But if you don't, then I think just if we can figure out what the goal is, as far as the rent subsidy, that would be great. So those are my things.
And Director Obo, if you wouldn't mind, I just want to get through all the comments, and then I want to catch people up with the conversation we had earlier, because I think that'll help. Councilmember Ravel.
Excuse me. My takeaway from the memo is that we don't really have a lot of flexibility in making changes to the general assistance program or the emergency assistance program. I appreciate Councilmember Reed's suggestion that we, and maybe Councilmember Herrickars as well, that we really try to make sure that we're hearing from and identifying all, the people in the community who really need whatever assistance we can provide. I was interested in the senior citizen tax deferral program. I don't know how often we people take advantage of that, but so, identifying, making sure that people who need the assistance know how to get the assistance, and then making sure that we give them the information about the various programs that are available is really, really important.
Before we go to round two, I think there's just some information I want to provide that I think would be helpful. One, Director Obo, can you sent some legal state statute language to me. Mm-hmm. Can you send that to everyone? I can't find it for some reason. Okay. I did, though, send everybody a breakdown of, how should I explain this? The amounts of stipends for each category is provided below. The max has increased over the years to $1,135 a month. So my understanding is that's the maximum that we can provide people through our general assistance program, not to be confused with the emergency assistance program, but through the general assistance program. So I think the first thing that I want everybody to understand is it's not as simple as we've made it, and we actually have made progress. So I think what I was asking for was misunderstood. And so what I explained at the last meeting is within our emergency assistance fund, which I think is funded through our general assistance dollars, if someone comes to me, and I've had this happen, where they have an emergency, so an emergency is required to receive emergency assistance funds, you have to have an emergency. And so our last meeting, I framed all of this within that context. This is somebody that's approaching the city who has an emergency and is trying to access emergency assistance fund to provide relief from a financial burden, which in the scenario I'm providing happens to be property tax. So what Director Ogbo and I have come to an agreement on is, while we wouldn't say we're using the $2,000 so this person can, pay their property taxes, we can say, for instance, one of the emergencies can be reduction of our work hours or loss of employment. And so we can say we're providing this $2,000 benefit to someone to cover for the loss of hours so again, we need to think deeper about these discussions, because it's not as simple as, we don't even know what the statutes are. That's why I just forwarded it to you. You're not going off of an understanding of the actual statutes. You're just going off of kind of a loose discussion that we've had about how how staff and how we may understand the program. But before our next meeting, I would really love us all to just read the statute and based our discussion and then any recommendations that come from it based on what it expressly prohibits us from doing it. I think Councilmember Reed would appreciate this maybe more than anybody, is that if it doesn't clearly direct you, if it doesn't prohibit something expressly, then there may be ways that we can work around it. I think there's already ways that we're working around certain things that came up in our last meeting. And so, but I want to bring that up because I think it's important that we've already in this short period of time found a way where for people who have experienced an emergency and have fallen behind on property taxes, we've already figured out a way to support them through our emergency assistance fund, which is all I was requesting. Now, as it relates to the second part of what I was getting at, which is, let me pull it up on my phone. So if you look at one, I want to make sure that I'm particularly concerned about people who are unemployed. And so the first thing is I want to make sure that maximum $1,134 a month, that we're giving that to as many people as we can who are unemployed, because they need all of it. If you don't have employment, you need every bit of that, especially if you're in Evanston. So just keep that in mind. That's the first thing I'm trying to figure out. But then also, if you look at so it's $675 a month for rent, $235 a month for personal needs, $75 for utility, $100 for food. It's not clear to me whether or not, if someone is unemployed, whether or not they get all of this by default. It seems like there's a lot of discretion within the program, which always concerns me if it's not consistent, because then that means somebody may get more benefit than someone else, depending on that staff person's understanding of their needs and what they can, what we can allow and what we can't allow. So that always concerns me. But so there's that. But then also like $675 a month, Councilman Reed brought up my point, which is I think it's going to be hard to find a place to stay for $675 a month. Really what we're talking about probably is somebody renting a room. And it may not be $675 on the head. Maybe it's $500. Maybe it's $400. And so let's say it's $400 to rent a room. I want to make sure that they don't lose out, on the $275, and that can be, reapportioned to some other category, right? I don't want them to lose that. And the way the program was described to me was if they don't use 675 for rent, like they lose that part of the, that part of the benefit. And I think that's a little too rigid. And so what I've talked to Director Ogbo about is maybe it's more of a range. Like you have to use between 500 and 675 towards rent. But if somebody says, no, I only want to direct 500 on rent, but I'd like to use the rest on the unrestricted, whether it's food or whatever it is that they have, we allow them to do that. So I wanted to describe that as just a baseline. We've heard from everybody once. I want Director Ogbo to provide some comment, and then we'll go to, I think, Council Member, who was next? Reed? Okay.
And thank you for the opportunity to discuss this matter. We've taken a look at the program and over the years made significant strides. There was a time when we had 300 plus individuals on GA, and we were able to decipher to where we are currently, where we have people who need GA that is in the tune of under 100. So with the years that has come, we've made these adjustments to where we are currently. When it comes to GA, this is a mandated program. There really isn't much of a wiggle room as it pertains to the basic necessities. The manual states the basic necessities are your food and your shelter. And the way in which we have figured out the shelter portion of it is we added elements such as utility to it, because if you're living in a home, you need utility. So that is part of the element of housing and food. We've done cost analysis of various jurisdictions where they offer GA assistance and even nearby communities. And as stated, we pay the highest stipend when it pertains to housing. What we've discovered in our analysis is that most individuals who are on GA are supplemented by other housing subsidies. And a number of them also are renting from maybe a family member or a roommate and what have you. The rent as it is right now, it is quite static. We can make some improvements in regards to increasing it. And one component of our program is when individuals come to us, keep in mind that this is a needs-based program. We evaluate their situation and see what needs and services that they need in other categories or in other areas. And we work with the individuals to figure out what resources that can be applied to the situation that they have at the moment. I know Councilmember Reed, you made some references to modifying the program where it is combined. And as you can remember, the reason why we have the refugee and the community relief fund is to have a separate fund for those who are undocumented or those who are migrants or refugees. The GA program is solely designed for individuals who are of legal status, and we do not want to commingle those two. So I also have Indira online, who is the manager for general assistance, if there's anything that I've left out.
Let's finish up with comments and then, so Councilman Reed.
Thank you. Where did the $1,135 maximum come from?
I can answer that.
Thank you.
Good evening, everyone. Indira Perkins, Human Services Manager. I apologize for not being there in person. I'm attending the domestic violence conference this week. The 1135 just comes from all of the amounts that are allotted, for the month. So that's how we came up to that amount. I will say what that does not include is a transportation stipend. If individuals come to us and say they need to get to work, or, you know, they are short on gas money, they need a bus card, we do provide that as well. When We also will increase our utility stipend from time to time if a resident is facing a disconnect notice. We'll also increase our utility stipend. So there is flexibility with this 1135 amount. We've also paid back rent. We've paid up on rent. So there is a lot of flexibility within that GA stipend.
Thank you. I think that
Just an attachment to what you said.
I think that the wording, I don't know if we should have used the word max if it's not in fact the maximum, because I think that could be confusing. And also I think just even using the word maximum seems as though there's some limit imposed by something other than ourselves. Thank you for the for mentioning transportation, because I did want to add, I think, again, I don't think that there is anything in the state law. I'd maybe lean on Ms. Loan to correct me if she knows anything different, or, to do some research. But I don't think our home rule authority allowed us to get rid of the township. We still had to keep the services, but there's a lot of flexibility here. And certainly we couldn't, if there are state laws on minimums, our home rule authority would certainly allow us to go over and do above and beyond whatever the state law is. And so, I think I heard transportation, which I think we should certainly be supporting folks with. I didn't hear childcare. And I think that's a key component to all of this. And so I'd love to see childcare included here, and a stipend that would allow folks to. Go ahead, Director Oakville.
So keep in mind with the GA, it encompasses the basic necessities, and as you indicated, childcare, we have identified that is a need in the community as well. So what we've done, because keep in mind, we do have a number of funding sources. We also have the Human Services Fund, where we have also used to cater to the needs that GA does not provide. So we have that flexibility there. So under our Human Services Fund, we do have a section there that is designated, that is designated for childcare, that we can use some of those funds for individuals who need such services.
In addition to that, we don't have a lot of individuals on our program with children because a lot of those individuals are eligible for TANF with the state. And the way that the general assistance statute reads is that if an individual is eligible for any other type of cash assistance, that makes them ineligible for general assistance. But we do have funding to provide childcare through other programs, but we don't really have a lot of individuals on general assistance with children.
Thank you for that. And again, I would love for our law department, or if just anyone can send me the statute that says that if someone is receiving cash benefits, that they're just prohibited from receiving general assistance. I would love to read it, and I'd love our law department to look at it and again see if we can go above and beyond, because we know that many, and who knows what happens in November, but we know that many of the federal programs are just woefully inadequate, whether it's the SNAP benefits, whether it's TANF, whether it's a whole host of these things. It's just not enough. And so if we can combine funds, I think that would be a benefit for Evanston families, particularly those with children. I also want to say that I think that the way we should look at some of this, Director, I heard you say earlier that we went from having over 300 folks on the rolls to now under 100, and to me, that's only an accomplishment if we can say that, in fact, the need has actually gone down in the community. And I don't think we've demonstrated that the need has reduced by 2/3 in the community. If anything, I would assume, the need has been level or potentially increased. I think that's really what we should be tying this to. And that's not the work of general assistance to solve the need, right? Because it's just a temporary solution. And that's going to be on this body and bodies, the state and the federal government to really change systems. But I think that's the metric we should be looking at. And if anything, I think we should be celebrating the department when we see, as long as the need hasn't gone down, when we see more folks on the rolls, and that should be a measure of success. And then lastly, I think, some of this, you mentioned that when I brought up childcare, it wasn't mentioned here because it's coming from a separate pot of money. To the person out in the community, they don't care where the money's coming from or what the pot is. If the money's coming from the city, they probably look at it as general assistance. And so I do think that while obviously for our own accounting and for any reporting standards that are mandated by the state or anyone else, that of course we need to keep track of the various buckets. But when we present the information to the public, we don't need to complicate it. We can just, we can easily, it's all general assistance or it's all whatever we want to call it. And, I don't think there needs to be a separate page where general assistance lists these benefits. And then, there's a separate web page where other benefits are listed. I think it should all just be on one page. It should all be under one category because to the end user, it's all the same. And go ahead, Director.
Yeah, absolutely. So when it comes to general assistance, as I stated before, the basic necessities, and I can understand where childcare can be incorporated in it. But based on the policy, it is outside general assistance. So when it comes to transparency, we try as much as possible to be transparent with the offerings of the program. And as you suggested, demarcating the programs would not disseminate well in the community members who are seeking for these services. Emergency assistance, as you know, is totally different from general assistance. So there definitely has to be a demarcation there because anyone can get emergency assistance, irrespective of income. So I see it there. So the way in which our general assistance is designed is just for those basic necessities. The other services that we offer are pretty much outside general assistance, but we do have some funding designated for that purpose. We've helped individuals who are moving, right? We've helped individuals with storage fees. Yeah. We've helped individuals with other services that are outside general assistance because I don't want to envision a program that is no longer general assistance, but I still want to provide enough services so that if general assistance isn't the program that will provide the need at that moment, that we have other sources that can aid in that person's situation.
No, yeah, thank you for that. I get that, but I think what I'm really trying to say is that, of course, we have to have those programs, and there's, again, state guidance on some of this stuff. All I'm saying is that for the end user, whether you want to, create a page that says, we already have care, Evanston Assistance or Evanston Helps or Evanston whatever, and then just all of those things are on that one page, whether it's coming from general assistance, whether it's coming from emergency assistance, whether it's coming from a separate fund that the health department has access to. I just think that all of the assistance that someone could get, regardless of the pot, should be easily accessible to them. Like, I mean, I don't know if anyone else up here knew that childcare was an option that we could help folks with. And so if we don't know that, as folks the only folks who are sitting, who aren't staff, and Bob, thank you, who are sitting here, I highly doubt that the community knows this in a meaningful way. And so I do just think that we need to, we need to get the information out there in a way that is digestible for people. that doesn't overcomplicate it. And I think we can achieve that. And if we want to create a whole new public facing title for all of this work that we're doing, we can do that. Internally, we can know where the different pots are coming from. But for the public facing, I think we just need to get the information out there, and let folks know that they can get storage assistance or childcare assistance, and more importantly to me, transportation assistance, all of that stuff.
And Councilman Reed, quickly, I just want to provide a quick example as to why this might be beneficial. I always like to use examples. I think it's easier for people to understand. But I've had people, one person in particular recently, who reached out to our Human Services Department to receive funding for something in particular, and was told, well, you wouldn't be eligible for it. And it ended up that she said the wrong name. It was one of the like 3 things that we did. It wasn't, because I think we also, it's like GA.
Guaranteed income.
Yeah, it's like we do GA, we do emergency assistance, but we also do, I think we do the guaranteed income as well. And so to your point, to them, they're just like, I need some help, right? Here's my situation. I need some help. I think if we started to look at our assistance in this way, we would naturally even train our staff to just, to listen to what they're hearing and, okay, we can provide funding because of XYZ through whatever program. So I just wanted to provide an example as to why us kind of thinking differently about how we talk about our programs and promote it to the community might be useful. Did you have any other comments?
No, that's it. Thank you.
Councilmember Hedekatis.
Actually, Councilmember Reed touched upon what I wanted to say, so.
Okay. Really what I would like is just more time with this. Again, the more Director Ogbo and I are able to meet about this, and I think it would be helpful if Director Ogbo, you can provide just all the state guidance on this. We have received, and I emailed it to everybody. It says Township Supervisors of Illinois General Assistance Handbook, but just based on the conversation, I would imagine that we're receiving more guidance from the state than this. So I'd love just to get all the legal guidance and standards that we've used to develop our program, so that I can review it. And then, if the committee allows, I'd like to continue to work with Director Ogbo between meetings, and then we'll likely have, some updates, for everyone at the next meeting. I will no longer be chair, but I'd appreciate, if Councilmember Ravel would allow us to discuss this at the next meeting as well. Allison, sorry.
If you wouldn't mind, I just want to let you and the community know that, I've worked with the GA folks for kind of a while doing guaranteed income, and just so that you have some assurance and the public has some assurance, they're always so fantastic at finding the right thing for the right person. So if somebody comes in and they say, I want to apply for guaranteed income, but they don't have they're not eligible for guaranteed income, the GA folks will work with them to see what they could possibly be eligible for. It's not like, well, that's not going to work, so good luck. Hope you find the right keywords next time. They're really fantastic at looking at all of the available options and seeing in what way we can provide assistance. So I don't want you or the public to think that it's like you've got to know the right code or something. Our staff is really fantastic at getting people what they need just to find anything if it works out.
Yeah, I would agree with that. I just also think there's a lot of discretion within these programs. And while that can be a great thing sometimes, I also think it would be, and this is part of what I want to work on, where it's like, if you're unemployed, you're not making income, you're an Evanston resident, these are the things that are available to you, right? And it not be, I think the way we're doing this now, I would imagine if someone were to do an investigation on this, they would see that there's not enough consistency within it because there's so much discretion. Whereas I think for something like this, it should just be, if your income is under this amount or over this amount, here's what you have available to you. And we should just, again, if I'm allowed, I would love to continue to work on this so that we can come up with some recommendations. I'm going to go to Councilman Ravel first to close us out with this. And
right.
then
Well, I was just going to say that
Director Ogbo.
to Councilmember Burns, I'm happy as the next chair to continue this conversation. I think it's really helpful for us to get a better understanding of our programs and what's available, and certainly for the community as well.
Yeah. Director Ogbo.
Absolutely. And keep in mind, even though we might not have on the fund and all the services within the assistance programs that we currently embark on, we also make referrals. We have external agencies that have come to our aid because of the situations of our programs that wouldn't necessitate providing such services to. So we rely on other external partners to provide those services, and they have been quite helpful. And the way that our staff members are trained is if an individual does not qualify for a particular program, they look for other programs within the department that can provide aid to those individuals. As far as GA goes, we are as consistent as possible that we can be in GA. We also have to keep in mind that every situation is different. And in some situations, we have to handle it on a case-by-case basis to offer assistance to those families. Emergency assistance, as I mentioned in the memo, it is a program that is offered to every community member who qualifies. And in the period of 2 years, we've helped over 100 individuals. So we do encourage individuals to apply. If they don't qualify for certain programs, it appears that there are other programs that they can qualify for. And if they're not programs within the confines of the department, we look for other avenues to provide services to those individuals. So I just wanted to provide that information.
Last thing I'll say on this, and then I'll move, if somebody can move to table this to the next meeting, is I think it would be helpful also to put so I'm looking at the general or the emergency assistance page on our website. I think it would be helpful to try to describe how the funds can be used. But we'll get more into that. I'll be in touch, Director. Okay, if we can get, if I can get a motion to
I'll
table this.
move to table this to our October meeting.
Second.
It's been moved and seconded. All those in favor?
Aye.
Any nays? Any abstentions? All right. Seeing no more business before us, I call this meeting adjourned. Thank you, everybody. Thank you.